Right, so I thought I'd film this little session because Janet hasn't been before.
No.
How are you feeling?
Okay, yeah. I'm looking forward to it actually.
Oh, are you? Good. A lot of people get scared. So Janet has had a really stiff neck, and you can even see, if I just turn you to this side, you can see kind of there's just a little bit of tightness going up and down. So Janet's been really suffering to the point where I guess you can't, when you're driving, what happens?
Well, it hurts when at junctions, you know, you're trying to look. I'm really noticing it then.
Right, so we've just got Janet, we're just doing a very short treatment today just to try and gently release her neck and shoulders. I don't want to aggravate it, and I can see that this is really, really tight, so it's going to be very, very gentle today. I use 100% grapeseed oil with arnica to really help with the bruising and the healing. So we're just going to add this on now. And I'm led by Janet, so if it gets too hard, if it's too painful, if you want me to stop, you just let me know. I'm going to start very, very, very gently, just so you get used to the feeling of the bar. Okay, it's cold.
Okay.
There we go. So how's that?
That's fine.
So we're just starting on this shoulder, and I've only been going, what, 20 seconds, and you can already see there's redness there. And has there been any pain?
No.
I'm barely touching.
Yeah.
But you are tight, aren't you?
Yeah. Yes, I am.
And you can tell because the petechiae, where the blood vessels just start to burst, is already coming through here, which shows she's got lots of scarring adhesions underneath in this tissue. So can you just zoom in on this here, these little red dots, and if you can see those? Yeah, and that's already coming through, Janet.
Okay.
So that shows how tight everything is. Not too hard.
No, it's fine.
Do you want to have a look at that? So we've just been going a couple of minutes, and you can see how red it's gone. This is why I wanted to take it really easy today. So I'm just going to go up now into the bit that's really painful. I'm going to be very gentle. How does that feel?
It's okay.
Okay, I'll go a bit deeper then. It's normally around here somewhere.
Yeah.
Is that where you can feel it?
Yeah, I can feel it there.
Is it too much?
No, I can cope with that.
Yeah, and again, the little red dots are coming through straight away. Just starting there, and if I keep going for another minute or so, yeah, you can see this poor muscle. It's gonna. Do you get headaches?
Yeah, I do.
You just want to like press into points when you get a headache to relieve that pressure.
Yeah.
Our bodies naturally know that we need to do that. You just want to get like a knuckle and push into it. So this is now joining up with the tightness on the back here, and there's a little bit there. There you go. Okay. So I've just gone onto the back of Janet's neck now. I've been going here a couple of minutes, and you can just see. Janet said this felt quite nice, didn't you?
It is.
It's just coming up here on the back. And Janet asked how often she should come, and I said every couple of weeks really until she's better, but it depends on each individual. It might be in a week she feels like she's ready to go a little bit deeper. This is a very gentle first treatment because Janet is in so much pain here. And everybody is different. If Janet goes away, she doesn't drink very much, she doesn't move, she doesn't keep mobilised, then it will tighten up a lot more than someone who is going to go away, drink, have good nutrition, do some gentle movements and shoulder rolls and gentle kind of yoga-y stretches. So it all depends on the person as to how often they need to come back. But Janet will need to keep coming at least every couple of weeks until this is softened. But I don't think it will take that long because you can see how well it's responding. It's really, really good. So you probably only need another couple of treatments. And I think you'd be able to then maintain it yourself. Then you might only have to come, I don't know, once every 3 months, 6 months, just for a little bit of a top up really. Okay. Janet's also mentioned that when she eats on this side that's tight, she feels it crunching in your jaw.
Yeah.
So I'm just going to do a jaw release. So we'll lay her down in a minute and I'll show you that. Right, so Janet's got used to this now, and you're all right really, aren't you? So the big bar's coming out, Janet. So let me know, this is going to be a little bit harder, but this is getting a bit further down, and you can see as I'm rubbing over this tightness, you can see kind of the lat down here in the armpit is kind of jumping, and you can see the way it's moving. It's not smooth, it's running over like a bump in the road. You can probably feel that as well. Is that sore?
It's okay. It's
You're all right for me
feel
to
it.
carry
No,
on?
it's okay. Yeah.
Okay. This will be getting a little bit deeper. This will be where it starts from, somewhere down here.
Oh, I can feel that.
That's all.
I can bear it. It's not unbearable.
Oh, yeah, there we go. Starting to come out. Have a look at the back here. You can just see it just starting to come out there. And if I carry on here, I think this is going to go as red can be. And I'm not going hard here.
So what you're actually doing, Carla, what is it actually doing for me?
So I was just saying to Janet that this area here is really starting to inflame and the pores are enlarging and this needs to heal. So what this process does, it's bringing an immune response to the area. It's flooding it with collagen, fibroblasts, everything your body needs to repair, but it's breaking down. Adhesions are like glue. So you've got everything's made of fibres, long thin fibres, and they should run smoothly. It's all, but they're connected at each end, so they can't tangle. We think of a knot as things tangling, but you've got fibres this end, fibres that end, and they should be smooth. But over years of you lifting and doing things, those fibres will glue together, and they're adhesions, and they're really difficult to release and break down. Hand massages are great and they'll keep you moving, but it's only something as deep as this that can get to the real root of the issue. I just asked Janet to move her neck left and right, and she said, oh, I can still feel it when you move your head to the right. And I said, where? She went, I'm not sure. It doesn't. She thinks she's imagining that it doesn't feel as bad already.
It's really good, actually.
So where do you normally feel it?
Here now, or down here.
Which is exactly where that redness is.
Yeah, I'm not getting the same pain. In fact,
wow.
Whoa.
Whoa. You'll be the exorcist soon. Spinning your head around.
That's brilliant.
So I'm going to keep going here a little bit because you can still feel something, can't you?
Yeah, well, nothing like before.
And then we're just going to carry on and release a bit more. I don't want to go too much more because it has released, but I'm going to do some longer strokes now.
Okay.
Yeah. So I'm just putting a bit of oil on Janet's jaw here just to see, because we've got the muscles, the mandible muscles, and they come all the way down here and we're getting a bit of clicking. It's not surprising because it all links in, doesn't it? So I'm really gentle here. Just finding the muscle. So this is like Gua Sha that you do on your face. Do you have a Gua Sha stone?
No.
The little heart shape like jade, or the jade rollers.
Right.
Gua Sha is literally what we've been doing on your neck. It's just skin scraping, and it's why people use the little crystal stone kind of things on the face, little heart-shaped things, or the jade rollers, and it floods this area with collagen, so you're going to have a wrinkle-free face on this side in the short term anyway. So you can see here that there's some petechiae that's just come through. You see that on there? So it's just tight, and you can see the jaw's tight. Okay. It's got moving a bit. You can see that coming through there. And you can see how close this is linked to this tightness. It's all connected. Okay, I think what I'm going to do now is just release. This shoulder's not happy, is it? So I'm just going to do here. This is going to be sore. Okay, so I'll be led by you, and I'm going to need a bit of help. You have to pull your boob out of the way. So if you can.
Good God, now you're asking.
This way. Do we get a crane?
Oh no.
So just so that I'm not touching the boob and I've got a bit more space there. I'm being very brave here.
It's fine, honestly.
That's good. Is that coming out there? We have men crying doing this. You see that?
Oh, I can understand that. Sorry, Ian.
Just been feeling Janet's arm, and you've got a big lump there. I don't know if you can feel that.
I really can.
And then Janet's had pain in her thumb, and she thought it was arthritis. So I've just got her to make a fist and rub this forearm, and it's agony. So yes, it might be arthritis, you're freezing, but it could also be the tightness here, the tightness here, the tightness here. You've probably got tight under here. Yeah. So I'm just going to do a quick release on her forearm whilst we're here. So I've just been rubbing into the hand and this joint, and you can see there's little tiny bits of red there where there's just tightness in this thumb joint. It's like it's seized up. Right. But it obviously could be coming from this redness up here. Just seizing up a bit there. Right, so have a little sit up now, and we'll just check how the neck feels. Check, careful. Take your feet off the edge so you're nice and comfortable. Don't worry, I've got you.
Okay.
How are you feeling now then? So gently turn left and right. Just see how it feels. Any better than when you arrived?
Yes. Much. I could really go further. I feel like I can really push that. Look.
Well, because
I know, but I couldn't do that before.
And you've got a tiny bit of redness on the jaw, but you know what? No one would even notice unless you pointed it out there. Go and have a curly whirly and see if that's what she has.
I've got to test it.
You have my permission to have a curly.
Just try another one because I'm not quite sure. But yeah.
Okay.
Yes.
Thank you so much.
Thank you so much. Wow.